Let me see here. My friend has been suffering from constant pain in the left side of his body from the neck all the way to the foot. Sometimes keeps getting better or worse. And worse. His MRI shows disc herniation at C4, C5. The interesting thing is that there is a lot of inflammation and pain in his chest, left side, as well as the doctor has been able to identify the cause of the link between the two. Or the doctor has not been able. Let me see. The body's nothing but cells and two major fluids. These two major fluids do circulate through the body. What's the link? You know, this is the lymph system, no question about that. What herniates a disc? What breaks down tissue? What inflames? What expands? That's acidosis. Acidosis dehydrates, breaks down, rubs calcium out, swells, dehydrates. And it would be obvious. This is left side. This is left kidney weakness. His left kidney, adrenals, can't just work on one kidney, but obviously his left kidney is more in trouble, or she, whichever, and this is important. You have to get the kidneys fixed and drain this lymph down out of this neck and down out of this area, because in time it'll affect the head area and the equilibrium and all that implies, from glaucoma to all these things like that. You know, you want to go, always when you have a herniated area, you want to go into the parathyroid to make sure you're utilizing calcium, number one. Number two is you want to get interstitially and move these acids out. These are weaknesses of connective tissue, excuse me, and you want to get in there and get these acids out of these tissues so the tissue can restore itself. No different than if you're going after anything else we've been talking about, Victor. But key point here is parathyroid gland. If you're bulging anywhere, you could wear a belt. The thing with groin hernias is that it's difficult because you're always in activity, so there's always pressure, and you could also clean up that gut to remove any pressure that might be on this hernia, and that'll be very helpful. But you just have to let tissue strengthen, and to strengthen is to clean and to strengthen both. You got to do both sides of this always, and then you'll be successful with that. Absolutely. All these vascular wall weaknesses, big trouble. This is how you get herniations and aneurysms right here. And this guy is in trouble. So he needs to go after his parathyroid. What we don't know is, does he have a pituitary problem? This is where we need more information. We need to take a look at his case. We want to look at his height. We want to take a look at maybe other factors that he's suffering with. We want to see if there's a thyroid weakness, a parathyroid weakness. We know. If there's other glandular weaknesses, we can take a look at his eyes and see if there's a pituitary problem, because we want to know whether it's a pituitary suppressing thyroid and parathyroid, or it's just a genetic parathyroid weakness. Either way, we're going after that parathyroid. If we have to pick up the pituitary, we can do that too, because that controls the parathyroid. But we're definitely going after the parathyroid. So I would do a parathyroid glandular, and I would do 1-3 times a day at least if it was me, and I would at the same time do the Bones formula or our superfood blend number 2, which is extreme in the calcium levels. So do those, because you want to utilize at the same time, you got to fix your lymphatic system. Herniations, we have some connective tissue problems. So we know that you can have a genetic weakness in an area like that and have a herniation from that weakness, but that weakness originated from someone that has a parathyroid weakness. So you have to go back and fix this young man's parathyroid gland. And I would do a parathyroid formula, add some bones with that. So you got some herbs that are directive and high in calcium. And then, of course, in that you've got the kelp with the high iodine, which trips up the thyroid and parathyroid. So you're going to go down that road. And again, this is whenever you're not utilizing calcium, as your years go on and the more acidic and the more you lose your kidney filtrations, the more you lose connective tissue and bone. And then your back twists, everything twists and turns, you know. I mean, it's just how it is. Here is a hernia. Does anyone know what causes it? I might have this enough. It hasn't been diagnosed, but in case I do, my option is surgery. If you have a hernia, this is RENI. If you have a hernia, that's connective tissue weakness. Now, you could have specific cells that are weak in that area, let's say from mom, dad, grandma, grandpa, somewhere where they also have a weakness in that area, either from a parathyroid weakness, high acidic body, or they've had an injury in the past and then conceived and that weakness passed on. I don't know how that works in terms of trauma to cells. I know at the time of conception, obviously, the consciousness of the cells at that time are past, and that would include, in my opinion, trauma to tissue, where that tissue could be weakened a bit in genetic memories. Interesting thing. But you want to work on your parathyroid, move your lymph to get those acids out of those tissues, move those lymphs, and then pick up on that parathyroid gland. Hernia, connective tissue. What do we want to think about here? We want to think about parathyroid, don't we? So I'm going to do just what I was talking about in these two other cases. I'm going to go to a parathyroid glandular. I'm going to take maybe 1-3 times a day, maybe 2 bottles worth, and I'm going to take a bones formula with that. I'm going to start strengthening my connective tissue up, aren't I? Sooner than later. But I'm also going to start moving out my acids, because when you see the deterioration of connective tissue, what side of chemistry are we on? Acids. Why? Acids have to be buffered. How do we buffer acid reflux in the stomach? Tums. What's another word for Tums? Calcium. See where I'm going? We're pulling calcium out of our tissue to fight acids, and then our tissue herniates. Well, herniation is when connective tissue holds everything together. Herniation is when that connective tissue gets weak and the tissue bulges, just kind of like a hernia. Is that what a herniation is? Where it expands through the connective tissue, whether it's in your bowels, umbilical, herniations can be vascular, it can be anywhere. You could maybe consider a polyp a form of herniation, even though it's a form of tumor / herniation. Whenever you see connective tissue giving way, you could consider, I think, diverticulums, bowel pockets, as herniations in their own way, where the connective tissue gets weak and you create a pocket or you create a swelling out of that. Move lymph, strengthen parathyroid. Move lymph, strengthen parathyroid. Moving lymph, of course, we know what that is. Get into the kidneys, the adrenals, get into the GI tract. Always go that way. And first of all, you know that when you're starting to see a hernia, you're losing your connective tissue. Now, calcium plays a role in all structure. Calcium plays a role in all neurological. But going back to structure, calcium plays a big role, and even connective tissue. So you're going to go up here to the parathyroid, and you're going to work on that. How do you work on something? Well, a couple ways. You detox it. In other words, you clean all the mucus and all the inflammation out of it. How do you do that? Well, obviously you have to do the whole body, because you can't just do the thyroid, parathyroid. So you got to get to the kidneys and get them filtering, get your lymph moving, clean up your bowels so all this can drain better. Your esophagus and everything sits on your bowel. Clean all that up. So you clean your sinus, get your sinuses. So to clean, you've got to go to the fruits, berries, and melons. To clean your body out. Vegetables will clean you to a certain point, but if you want to clean and get rid of tumors, you've got to go to the fruits and berries and the melons, or the water fasting. There's nothing else to say about it. The herbs. To help clean the kidneys, to help clean livers and spleens and hearts and lungs, and rebuild. Body loves to be healthy and rebuild itself. So anytime you see a loss of structure, sagging, herniations, suspecting aneurysms, bruising easy, spider veins, varicose veins, cramping, depression, big time depression. If psychiatrists only knew how simple it is to fix depression, but putting people on these antidepressants that only lead them to suicide, I don't know. I mean, we're still living in darky, agey thinking stuff. How do you cure or help a hiatal hernia when there is pain? Wow. Well, again, you got to go to the fruit, berry, and melon diet for all obvious reasons. Hiatal hernia, you can't swallow anything that's real coarse, anything that's dry. You really need the fruits, berries, and melons, and you need to super chew, especially if you're really closed off. If you got pain, you want to get this out of there. This is the lymph system interstitially in the esophageal wall, but my guess is you're backed up in the gastric and your intestinal walls as well. Move your lymph.
When we just talked about that early on here about herniations and aneurysms, things like this, where tissue gives way. Well, again, when you're looking at strengthening tissue, you're looking at connective tissue, and that connective tissue has a high calcium component. It's directly involved in parathyroid hormones, so this is why. But also remember causative effects. Now, there could have been a weakness there from birth and blah, 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 blah. But in that said, why didn't it strengthen up? And look at diet. When you have weaknesses, even genetics, if you're on this high level of energetics and chemistry, it will go back, remember genetically, DNAs, and rebuild that tissue. I've seen it every time. You can't deny it. Some of you are rebuilding your genetics this very moment. Some of you already told me you rebuild your genetics. I mean, it's coolest stuff, and you can see it in the eye. Incredible stuff. Instead of being pessimistic, people need to be optimistic. Instead of being the negative, be the positive, if you want to look at it in that way.